Welcome everyone, and thank you so much for joining us today. My name is Erica Fotheringham, and I am the Manager of Programs and Equity here at CanWatch. I am very excited to be here today with members of CanWatch's Gender Equality Working Group to dive into an engaging discussion around lessons learned on gender transformative programming in the health sector. So today, I have the privilege of joining you from the traditional lands of the Haudenosaunee, Wendat, and most recently the Mississaugas of the Credit Peoples, commonly known on settler maps as Toronto, Ontario. I would like to acknowledge the traditional, ancestral, and unceded territory on which we are learning and organizing today so that we can keep aware of where we are and what the history is. We have folks joining us from across Turtle Island and across time zones. This is a moment for us to pause and to reflect on the continual occupation of Indigenous land, the relationship we have with the history of the land and colonialism, and how we're going to move forward. I honor their long history of welcoming many nations to this beautiful territory, and I uphold the voice and values of our host nation. So just to kick off the session on some technical notes before I pass it off to our speakers today, this session will take place in English, and we will have a question and answer period towards the end of the hour. So we welcome you to use the chat box to submit any questions you may have throughout the session, and we will do our very best to get to them at the end of the session. Please note that this session is being recorded, and this recording will be shared in the coming weeks, along with the presentation slides and additional resources that our speakers today will speak to. And of course, if you require any additional technical assistance at all throughout this next hour, please do not hesitate to send me a message on Zoom, the chat box, or Tina La Rochelle, who's also here from CanWatch. And I am so excited today to introduce Meredith Holt-McKenzie. She is a Senior Gender Equality Advisor at World Vision Canada, and a brilliant one, just to add to that, and she will kickstart today's discussion. So over to you, Meredith.
Thanks very much, Erica. It's a real pleasure to be here with you all today, with my fellow CanWatch Gender Equality Working Group colleagues, Saif and Alice. This session has been in planning for several months as we've worked to find the right timing to do the presentation. And I personally was very excited in the fall when World Vision Canada drafted a report outlining the 5 elements that we found in common in most of our gender transformative programming. And I was really keen to share these. And as I talked this over with Saif and Alice, we settled on one of those elements in particular, the engagement of men and faith leaders in transforming harmful gender norms and practices. So today, on the Gender Equality Theme Day of International Development Week, we invite you all to listen in on our discussion about programming approaches to working with men and faith leaders on gender equality. And in doing so, we will move from the conceptual to the practical with several programmatic examples along the way. I invite my colleagues Alice and Saif to introduce themselves, and then each of us will provide a brief overview of our work before we launch into our discussion. So I pass the mic to Alice.
Yeah. Hi, good morning, everybody. It's great to be here together in this space, and thank you for joining us. I'm a grants program manager with World Renew, providing strategic leadership in the co-creation of programming that advances the quality and sustainability of gender transformative work. So we're excited to share with you. And I'll pass it to Saeed.
Hello, very good morning to everyone. I'm also very excited to be part of this panel to talk about our gender transformative programming and strategies of male engagement in religious leaders. My name is Saifullah Chaudhry, and I'm Senior Advisor Gender Equality with PLAN International Canada. I send it back to you, Meredith.
Thanks very much, Saif and Alice. So I'm going to share my screen. I have a hugely sized oh my gosh, now I can't find it. Can you just let me know if you can see my screen?
We can see it. It's just not in presenter mode yet, but it's there.
Okay, great. Thank you. Okay. So I'll just finish by saying that I work at World Vision as their senior gender equality advisor. I work on the program and policy team, and specifically work on positioning our work that we're doing at World Vision and on ensuring that we've got programmatic alignment with the FIAP and also just generally with gender equality practices, best practices, and feminist principles. So as I mentioned, I'll be sharing today on experiences engaging men and faith leaders. So in 2021, we finished a gender review where we looked at how we are addressing gender equality. We had previously done a barrier analysis with women and girls and men and boys to figure out what are the barriers to gender equality. And we wanted to see how are we addressing those barriers. Excuse me. And it isn't often that you hit upon in development work a recipe for success. Most endeavors are hard fought, taking years to achieve sustained progress, while some attempts completely backfire. But a recent review, the one I'm referring to, revealed ingredients for long-lasting transformation in the rights of women and girls. So we reviewed 10 years of programming, including 50 projects that spanned the globe: Africa, Asia, the Middle East, Latin America, Eastern Europe, to see how we were addressing the barriers that had previously been identified. That's another presentation for another day, and what lessons we could apply. And what we found was that the majority of projects which effectively addressed gender equality and the empowerment of women and girls contained several key elements, and we'll call them ingredients, that simultaneously addressed agency, relations, and structures to achieve gender equality. So these are the 5 ingredients. Based on this review, we identified addressing gender equality and empowerment of women and girls as both a core objective and a key contributor to positive development outcomes as the first one. Partnering with women and girls and their communities to strengthen agency as a second one. Fostering enabling environments. Elevating the social value and position of women and girls. And finally, transforming social norms by engaging men and boys and leveraging the influence of multi-faith and traditional leaders. Now, there's a lot to unpack here, and I would love to be able to spend this whole session unpacking these 5 with you, but I'm going to focus today on this last one. And what was interesting in the conversations with Alice and Saif is that this isn't unique just to World Vision. A lot of us have identified that engaging men and boys and leveraging the influence of traditional faith leaders is really critical. So I'll start by saying that faith leaders serve as one of the most trusted sources of information and guidance in communities. World Vision's faith identity and focus on community and empowerment enables it to establish trusted relationships with influential faith-based organizations and male and female faith leaders, and that allows us to multiply impact. It should be said that World Vision works with a variety of different faith leaders, and in communities where attitudes and behaviors related to gender and gender-based violence are influenced by religious values and beliefs, faith-based programs are well positioned to transform mindsets and behaviors from those that deny women and girls their rights to those that foster gender equality and the empowerment of them. World Vision has developed project models that directly address Christian, Muslim, Hindu, Buddhist, and other faith leaders' conceptions about gender equality and the rights of women and girls, facilitating reflection in their own religious texts. Our programs are informed by deeply held cultural and religious beliefs of community members, allowing us to leverage faith leaders' capacity to contribute positive social change through their ability to link to development interventions to underlying values and beliefs relevant to the local communities. And faith leaders and traditional leaders have played a hugely critical role in helping us to combat sexual and gender-based violence and harmful traditional practices, including things like child marriage and FGM. We have 3 approaches that we typically use. I'm not sure I've got time today to go over all of them. I will be talking a little bit about channels of hope later, but the three that I will highlight a bit are channels of hope, gender, do no harm for faith groups, and becoming one. Some of these work directly with specifically faith leaders. Some work with a variety of different, faith leaders within the church or the mosque or the temple, not necessarily with the leader, him or herself. And then the last one, becoming one, is one that works with couples in the context of their faith community. Engaging men and boys is another really important area of focus for us. And men and boys, what we feel is that they have got a lot to gain when harmful gender norms are challenged and replaced with positive masculinities. And as traditional power holders, men are in a unique position to serve as influential gender equality advocates by working with other men and boys to speak out against discriminatory gender norms that perpetuate discrimination and inequality. Often as perpetrators of violence as well, men and boys need to play an active role in protecting their families and communities from gender-based violence and serving as role models. We've implemented the Men Care approach, which has been coordinated by Promundo and Sonke Gender Justice Network to promote men's equitable involvement as caregivers in the lives of their families. And this has been very effective for us. Three of the things that I'll focus on is that this has allowed us to challenge restrictive and discriminatory gender norms that devalue women and girls, to promote equal sharing of domestic unpaid care work between women and men, and to facilitate equal intra-household and community level decision making. So this is, and I know that others also use Men Care. It's not unique to World Vision, but it has been very effective for us. I'll leave it here, and I think I'm going to pass over to Alice next, or maybe it's Saif. I know it's Alice, sorry.
Great, thanks Meredith for that great overview and getting us started. I'll just share my screen. Someone let me know if you can see my presentation.
We can see it.
Okay, great. Thanks so much. Great. So I wanted to share from World Renew's perspective and gender transformation in health programming. And just to give people a bit of a background, World Renew is a Christian international cooperation humanitarian organization, and we've been working in the sector since 1952, addressing some of the root causes, impacts of poverty, of disaster, and systemic injustice. And because we work in local communities for the long term, World Renew uses participatory learning and action methodologies to really engage with communities to understand challenges, for communities to evaluate their own assets and ultimately to come up with their own solutions. Recognizing that, oh, sorry, my slide's jumping. Okay. So recognizing that 8 out of 10 people in the world, they profess to a particular religious faith. We understand that World Renew has an opportunity to use our unique niche of having long-term partnerships in communities and with churches. And so for us to harness and address some of the social and cultural norms that particularly further inequality, and especially those that are looking at some patriarchal societies. And because we understand that gender inequality results from generations of behavior to perpetuate some of these gender norms, it's critical that we have a long-term grassroots approach that seek to challenge some of these cultures in a non-threatening way. And often communities have more trust and faith in their religious leaders And so we recognize that this is a unique area for us to be in. And as we talk about engaging faith leaders, we recognize that they have an influential role in their communities, and what they say is often respected. And so World Renew engages in dialogue with local, traditional, and faith leaders, both men and women, as we seek to understand the key determinants that affect health related to MNCH, WASH, HIV/AIDS. So really looking at some of the social behavioral changes. To give an example, in some health programming, adolescent sexual reproductive health rights program in West Africa, namely Senegal, Nigeria, and Mali, recognizing that there are varying degrees in which rights of use are recognized. We seek to understand some of the social cultural practices that might perpetuate the higher rates of child marriages. And so we explore with religious leaders in the communities, why these practices are continued, and really seeking the voices of youth as they want to share their desires for delaying marriage, pursuing education, and other opportunities. And I was fortunate enough to be part of an evaluation of a program in Nigeria, and a lot of the parents, they reported their daughters really influencing their way of thinking, trying to sort of change opinions for the correct age of marriage, sharing their desires to further their education, to live a life free of domestic and sexual violence, and for them to become leaders in their own communities. And we have seen parents and religious leaders really engaging in the rights of adolescents. And the faith leaders, they see the changes in the youth, whether it's having healthier practices in their health, making better decisions in life partners, and changing some of their attitudes. And so the faith leaders, they speak out against early marriage. They speak out against sexual abuse that happens in homes and in communities. And often we engage religious leaders, whether they're pastors or imams, and they use their platform as they can engage in their community, and to really encourage parents and youth to participate in these programs. And so we recognize that church and mosques are important institutions at the center of community life, and that's we can use them to mobilize participants and work together. So really working with religious leaders is important in not just accessing communities, but to support long-term sustainable health outcomes. As it relates to engaging men in gender transformation, World Renew really focuses on the first 1,000 days of life. So that's being pregnancy to age 2, preventing child stunting. And as an example, in Honduras, we work with male health champions who are community volunteers who are trained, who engage other men in understanding the different stages of pregnancy, how to seek healthcare, and developing positive relationships with their partners and children. And so these men are involved in antenatal care, with birth preparedness, identifying any complicated signs of pregnancy, and creating special bonds with their newborn, and supporting their partners, and supporting their partners in childcare, in reducing maternal load, and encouraging and supporting women as they continue with breastfeeding. And so World Renew tracks the proportion of men who change their behaviors towards more active involvement in health decisions, active participation in childcare. And some of the success factors that we realize is that there needs to be co-creation and adopting training that is appropriate for men, and a methodology that speaks to gender and masculinity. And so, in the past, we used to invite men to participate in health and childcare training. And And then we realized that, there was a lot of like inconsistent attendance, and eventually they stopped coming. So after receiving some feedback and soliciting some recommendations, we realized that, men prefer to have their own group where they could dialogue about their understanding of gender and their roles as male role models, and how they can contribute to childcare. So, really understanding that there needs to be targeted training appropriate for them, where they could sort of discuss some of their ideas about male engagement and machismo. So I'll just sort of end it there, and I'll pass it to Saeed.
Thank you very much, Alice. I'll start sharing now. So, Erica, help me if you could see my slides. Okay.
You have it perfect, Saif.
Brilliant. Thank you very much. So in this sort of brief presentation, I'll talk about our learnings from male engagement strategies that PAN International sort of experienced while implementing its flagship project, Strengthening Health Outcome for Women and Children, or briefly called Shu. And in this presentation, there are three parts. First, I'll sort of briefly touch upon Shu Project's gender transformative strategy, which was implemented in 5 countries. And basically, this transformative or gender transformative strategy built on the ecological model. Second, the Male Engagement Fathers Club. So what we did and what were our learnings to engage men. And lastly, our experience which we had in Sokoto, Nigeria, to engage religious leaders, both what we did, our strategy, and what were the learnings. Shu Project, it's a 5-country multi-year project, which operates at scale in these 5 countries, which you can see on the screen, and has reached over 2.3 million participants in total. As you can also see, this project is also connecting with Canadians, and then in addition to men, boys, and being a large part of our reach, as well as women and children. So gender equality, Shu Project's gender equality strategy straddle the entire results framework, and it took a social ecological approach. The core activity at center of it is the right holders, women of reproductive age, building their agency and of women and girls. Several activities here aim to move them to address their personal and gender-related barriers. At the second level, the several activities and interventions were aimed at engaging with men, religious leaders, and other power influencers at the household and community level to create a supportive environment for women and girls and good MNCH SRHR outcomes. And at the third systemic level, we had several activities rolled out to ensure gender responsive and adolescent-friendly MNCH and SRHR services. So that's sort of broader strategy. And within this, I'll just focus on Fathers Club, which was aimed at engaging men. So based on the 5-country gender assessment findings, PAN International jointly with Promundo, we developed a Father Club's intervention. For this Father Club's curriculum was developed and contextualized subsequent to the 5 countries. Also, community-based male facilitators were identified and trained as male champions to facilitate those sessions. And then men themselves selected voluntarily themselves to participate in this group and learnings. This was the module which was developed, and it was premised on our do no harm principles. So in the Fathers Club manual, there were 20 sessions which were incrementally building on, and there was a progression on. So these sessions basically encouraged reflection on gender stereotypes and redefined gender roles and behaviors around care work, and promoted joint decision making reflection on the cost of manhood on men, women, and children in communities, encourage men in social action to challenge the harmful gender norms that perpetuate violence and poor health and promoted healthy family relationships, also motivated men to participate in the management of pregnancy with a focus on child's future. So Fathers Club reach across the 5 Shu Project countries, about 11,000 communities-based male facilitators were trained as male champions. More than 1,000 male groups were formed, and more than 15,000 men self-selected themselves to undergo these 20 reflective sessions of the Fathers Club. Subsequently, Plan International conducted 4-country researches to assess the impact of father clubs as well. And these findings revealed that positive shifts in men's attitude and behavior. For example, it talked about that the research participants reported increased male engagement in the continuum of MNCH, SRH care, and support for women's access to health care. Men also moved away from stereotypical gender roles and started taking part in household and childcare work. However, such men care roles were often regarded as help to women, and quote unquote help, and not a joint responsibility. Men also adopted non-aggressive communication styles, and women in all countries reported increased feeling of love and peace in spousal relationships. Father-daughter relationship improved. Men experienced social stigma. Across these 5 countries, or 4 countries, they reported to us. And participation in Fathers Club was universally identified to have triggered these changes among men. Now I'll move on to Shu's Project Sokoto Nigeria experience in engaging the religious leaders. Under the overall Shu Global Male Engagement Strategy, the Shu Nigeria project in Sokoto State, the religious leaders were more intensely engaged because of their strong following in their respective communities. So the building ownership of religious leaders on MNCH and SRH and gender equality was a systematic sort of effort, and lots of engagement which took place. Multiple meetings to engage religious leaders were organized and enable them to understand MNCH, SRHR issues and gender equality issues. Ministry of Health officials presented maternal and child mortality situation and data in the state of Sokoto. Male and female religious leaders were invited to these workshops for to developing these messages. The key element, as Alice also mentioned, we also experienced co-creation of the manual. The messages were co-created, meaning the Islamic leaders or Sheikh Imam from Sokoto State was taking a leadership in that, and jointly with Plan, he co-created the manual, which was also reviewed by religious leaders from different sects and sort of endorsed there. But the final piece was strengthening ownership was validation and launch event, which Plan International organized. What the purpose of this sort of validation was that everybody, all these religious sects could review and validate. So there was a unanimous validation of the manual, and subsequently the launch event was also organized to build the ownership of the local stakeholder. The idea basically was, these are some of the images from those events, engagement events, to ensure that religious leaders, men and women, engage on the creation of this manual and also endorsement of the manual. This next image talks about, images from the Islamic perspective of MNCH issues manual, and you see the whole list of signatures. These are the religious leaders from different sects who have reviewed and endorsed it. And that endorsement formed the basis of ownership by the mosque imams to own the message, that is the message which they would like to share through their Friday sermons, for example. So manual Islamic perspective on MNCH issues, various issues. It covered, for example, topics like Islamic perspective on maternal and child health issues, encouraging husband to guarantee rights of wife, care for women in MNCH, continuum of care, joint decision making, child spacing, among others. So the dissemination strategies were primarily centered around Friday sermon at mosque, where the male mosque imam were disseminating these messages. However, the female religious leaders were using radio and television shows to disseminate these messages, and community engagement talks, for example, at wedding event or other sort of cultural religious events. Ramadan was a special month during which these religious leaders also disseminated these MNCH, SRH, and NGE messages to the communities. Plan International and Pramando jointly did a study to document the field experience from engaging religious leaders in Sokoto. And these are, in these sort of interaction, the study clearly documented that the religious leaders not only started owning these messages, but also disseminating these messages, and they reported various anecdotal evidence how men and women receive these messages, indicating the success of this intervention. From this study, the key finding, the main finding of the study indicate the success of religious leaders' engagement in the show. Secondly, community level changes in MNCH, SRH, and gender equality, because remember, this is part of overall social behavioral change communication strategy, which Plan International implemented in Nigeria, Sokoto State. So this was a very, the religious leader engagement was very prominent part of that. Also changes among religious leaders themselves through this learning and sharing processes, as they also felt the need to act as role model. Challenges, religious leaders indicated that older men were more reluctant to change than the younger men, and female religious leaders indicated they did not have the luxury or to access the group of women every week like male religious leaders at Friday sermons. And also the manual development was itself a challenge in the beginning, as religious leaders from different sects had different interpretation of religious teachings. So these were our learnings from show in terms of male engagement, Fathers Club, and religious leader. And I'll end my presentation here and pass on to basically Meredith to talk about so what from these three presentations, what has come very clearly, if you allow me to say that, engaging men has come out a very prominent strategy in a gender transformative programming. So despite the successes that we three organizations have experienced, we also have experienced challenges in implementing these male engagement strategies. So why don't Meredith, you first talk about what sort of challenges that you experience in your programming to engage men and boys?
Sure, thanks, Saif. I love the slide that you had with the lessons learned on it from the Shu Project. We've also done something similar on 3 projects, and we'll have a report coming out, some really similar findings. So I think people that are interested should collate a lot of these experiences. One of the things that I wanted to highlight was the suspicion that can grow amongst women as to men starting to take on a greater role. One of the things that we found was that there was some pushback by wives about their husband's involvement, and they were a bit resentful as to the sudden change in behavior. What's going on? Why are they suddenly wanting to help? And perhaps an indication that their husbands had been unfaithful and they were feeling guilty. I don't think that this is just unique to places abroad. I think that this is something that I think that Canadians would also relate to. And I think the projects realize the importance, really, though, of engaging women in this behavioral change process. And so in order to have a smooth transformation of men's attitudes and behaviors at home, and to emphasize the need for spousal communication and collaboration. And so to address this, the project started to open up lines of communication between husbands and wives through couples, as well as women's only discussion groups. And I think initially the women's groups and those couples groups weren't a part of the configuration, and that was sort of developed, and it helped to clarify why men were changing their behavior, and allay any kind of suspicions and concerns. So one small example, but that was one that I also noted on your slide, Saif, that was an experience of the men there. Alice, what kind of challenges have you faced in male engagement programming?
Yeah, thanks, Meredith, for this question. And for us to be honest, that male engagement isn't always easy, and there are challenges. For us, it's been because male engagement in health and particularly childcare is often very countercultural, and it's shifting gender norms that have been practiced for generations. So some of the challenges is having men stick to sort of their new conviction and their new role. How do we sort of sustain that? Not just until the end of the project, and then we sort of just trust that things have been transformed. So we're always asking I guess people to maybe change the way they're thinking and addressing. And so that doesn't just happen with a series of trainings and a series of dialogues. And so really working long-term and journeying with people, walking with them for the shared mutual understanding, and delving into the real practical issues. What does it mean now that I'm sharing these roles and responsibilities? For a woman, what does that also mean to share some of the burden that their husbands have making decisions together? And so it's really important that the men that we work with, they do have a platform for sharing, for continuing sort of this new way of thinking. And so it helps if the men are opinion shapers, they're traditional faith leaders, because they're already respected in their community. They have some sort of platform so that they can continue to train other men. So I think some of those challenges is how to sort of sustain this new way of thinking, and creating real safe avenues to speak. So that's some of our perspective. Saif, I'm just wondering, have you noticed any challenges related to father clubs under the Shu program?
Oh, yes, indeed. Despite the success of Shu Project's male engagement programming, initially, of course, we also experienced a pushback, as Meredith Ju mentioned, pushback from the wives of the men who were participating in fathers clubs. Some women, for example, complain that men are getting into sort of their spaces where they could make their own decisions, for example, and sort of telling them what to do and how to do things, for example, in care work. So this whole push that you've created to sort of help men to reflect and think and take responsibility and do the care work. So that was sort of a sort of fallout of that. Of course, that through our own this Fathers Club sort of engagement, because it was not a 1, 2, or 3 of events, it's a series of events, weekly or bi-weekly sort of meetings with men groups. So we sort of try to manage it by encouraging men to collaborate and support their wives or partners in care work and have access to sort of health services, as opposed to dictating and telling them what to be done. So it has to be sort of a discussed sort of thing. Another issue that is what we experienced, at least what our male participants of Fathers Club experienced, was quite a bit of a social stigma. The social stigma in terms of from their families, from the male peers, and not in one country. I mean, we are working in 5 different countries, from Bangladesh, Nigeria, Senegal, Ghana, Haiti, the diverse cultural context, but everywhere the men experience this social stigma. So the ridicule, for example, also particularly from female family members or extended family members like mothers and sisters, neighbors and their friends, for what? For adopting or demonstrating positive masculinity traits, for example, particularly for those doing care work and child care work, which was, okay, not a man thing, it's more of a women thing to do that. To the extent that some of men reported that they were called names like you're half a man or you're not a man. The mothers even blamed their daughter-in-laws for casting a spell on their sons or doing a voodoo. But these men remained steadfast, and because they felt that was good for their families, and they didn't sort of move back and push back. But I guess in future, any future male engagement programming, more support and tools need to be provided. to participating men to withstand and even counter social stigma while continuing to model positive sort of a behavior or gender equality norms and behavior. So these were two very interesting sort of lessons which I thought I should share with you.
Saif, your example of sort of ostracization and stigma and bullying isn't unique just also to male clubs. This kind of hostility and ridicule also happens among faith leaders too. I'm sure you both have some examples of that as well. I'll share an example from a training in South Africa where we were using our Channels of Hope model, which, like faith leaders are just human beings, and they're also on their own journey to understand gender. But some start by being quite hostile and and this is particularly when the authority of their religious text is being questioned. So in this particular training, we met with the faith leader where he was giving lots of time and space for healthy and constructive dialogue about controversial issues. And we reviewed scriptural passages that were are particularly tricky, and invited him to, contribute his interpretations. And there's others at the meeting as well. What were their interpretations? And a number of the other members who were there were very much gender equality advocates. So at one point, one of the trainers, another African pastor himself from, I think, Zimbabwe, asked this South African pastor, are you reading your Bible or are you reading your pastor? Meaning, are you taking the Bible as authoritative or what your childhood pastor said the Bible said, and therefore was authority? And so sort of challenging him to reconsider his interpretation of this particular scripture that was giving him an issue. And then finally, we asked him to consider this in light of how would this work practically with his own daughters? He had 2 or 3 daughters, and allowed just sort of positive peer pressure to play out. And in this group, there was a lot of real support around him. And for this particular pastor, this was transformative. He committed to go home and to apologize to his wife and his daughters. And since that training, he's become a huge advocate for gender equality, and in particular, anti-gender-based violence and anti-intimate partner violence work. So I think that's a really neat example of sort of the transformation that's happened in one person's life, but also just that sort of sense of feeling like when your core beliefs are threatened, and when you feel like you're being asked to reinvent something, that can be very threatening. And I think it's much easier for also for religious leaders to fall back on those tried and true interpretations. And that's one of the things that we've been working on trying to change. I'm just trying to figure out who am I going to next. I think maybe I wanted to go to Alice and see if Alice had some thoughts or experiences on that as another faith-based organization too.
Sure. Great. Yeah, thanks, Meredith. And some of your comments sort of resonate in terms of some people might feel threatened in terms of what are they losing in terms of power and access. So really, shifting some of the thinking and worldview. I guess with World Renew, our deliberate engagement with men and boys and community opinion shapers is really based on the understanding that communities have their own autonomy to find their own solutions. And so, when we look at poverty, we don't simply just assume that it's a material deficit, but that it results in some brokenness and some harmful practices that are often rooted in belief systems, ideologies, and worldviews. And so we know that religion and culture shape a lot of societal norms, and some of them are harmful, in which a majority of power is held by men, and women are largely excluded from decision making. And so we recognize that sort of to challenge some of those gender norms, to engage in those discussions. So really working with faith leaders and traditional leaders in restoring some of this brokenness. And dialogue about what healthy belief systems are, and to sort of foster some of this injustice, systematic practices and sort of oppressive ideologies. And so part of that is working with faith leaders, and what does reconciliation look like, and advocacy, what does a just society look at, and sort of renewing some of those gender roles and structures. And as we all know, with COVID and the pandemic, this work is even more important. There's mounting evidence that gender-based violence has increased, domestic violence has increased, and so much more need for us to work together across all these complicated lines. And Saif, I just wanted to ask you, what success have you noticed in the Shu program in engaging religious leaders?
Yeah, there were challenges, of course. And whenever you talk about engaging any faith leaders, religious leaders from any sort of school of thought, whether it's any faith, Islam or Christianity or Hindu or other, there is this whole issue of ownership, that what you're trying to talk about it, do they own it, or can they own that message? And if that message is not sort of owned by them, it will be difficult for the religious leaders to sort of talk about it and take that forward. So that was very clear to us in our Sokoto model, in the Sokoto experience. So for example, one of the things which we did was in partnership with Ministry of Health, State Ministry of Sokoto, and Ministry of Women and Gender Affairs in the Sokoto, we identified a lead sort of a religious scholar who was sort of a revered or well-respected in their community, and we found one. And that was a good first breakthrough in the development of messages, or what we talk about Islamic perspective on MNCH, SRHR, and gender equality manual, jointly with them. So that was an important point. However, that was the first thing. The second challenge which we experienced was that there are different sects in Islam, and they sometimes take different perspective on issues, like as you also mentioned, that how religion shaped different the lives of men and women and boys and girls. So there were different perspectives, and they all came because in this sort of a co-creation of this manual, so they all came with different interpretation of the Quran, and making it or teaching of Quran, for example, and making it difficult to reach a consensus on how to interpret certain passages, or the hadith, which is saying of the Prophet, peace be upon him, Prophet Muhammad. For example, some religious leaders disagreed to the importance of child spacing, and quoted a hadith saying of the Prophet, quote, "For if Allah wills to create a child, no one can stop him," unquote. So the hadith, this saying of the Prophet, was initially in those discussions interpreted by most of the religious leaders as meaning that neither men nor women had a role to play in child spacing. However, the benefit of lead sheikh, who had much more, a broader view of the religion and the teaching and the jurisprudence, he succeeded in uniting these religious leaders. And one of the Islamic argument which was discussed highlighted the prevention of pregnancy is neither killing nor an abortion of a fetus, because the semen from which a fetus is created is not in itself a human being. So these are the kind of argument which were discussed. So without going much in depth into those theological arguments, what I'm trying to highlight is that it's not easy or straightforward when you engage religious leaders, and so there are debates, and you need to ensure that there is somebody who has this broader view of religion and who could sort of guide people and unite people that way. And before it finished, there was another challenge also and the specific information on MNCH, SRH was difficult to discuss in the community, and religious leader felt why? Because they felt that they are going with the community where community health workers are there, the health professionals are there. So when they're talking to those health professionals and they're talking about MNCH and SRH issues, sometimes they didn't feel comfortable. So there was a need to arrange a refresher for them so they can speak in confidence and only speak that much what they know and don't go into areas which is problematic and they can lose trust. Also, religious leaders, the female religious leaders, for example, didn't have the opportunity to weekly or periodically speak with a group of women, as opposed to male religious leaders who every Friday sermons they have access to captive audience of men to talk and teach them. But clearly, as mentioned, as we all been talking about it, it's a constant work, and engaging religious leaders is an important work, which will help you to reach out to a larger audience and have more strong potential to impact to create that as part of your SPCC messaging programming. Alice?
Yeah, thanks, Saeed, for that insight. And I just wanted to make sure that we have some time to look at some participant questions. And so maybe we'll just jump right into it. And this first question is for you, Meredith, from Claudia. She just says, excellent presentations, thank you. She's just interested to hear more about the connections you've seen between engaging fathers and empowerment of their daughters.
Yeah, so that's a great question. I think a good example comes from our Enrich project in Bangladesh. We did a study last year, so it's kind of handy in my mind of the connection between the adolescent girl power groups that were running in that project and COVID-19 and resiliency. But part of that study also looked at fathers and the attitude of fathers. And it was really interesting that the fathers that had been part of the fathers clubs, the men's groups, where they went through similar similar series of training to what Saif mentioned in the Fathers Clubs on the Shu Project. Those men were far more like their thinking had evolved much more around supporting their daughters. And so sort of it's one of those things that also relates back to the report that we did last fall, where we looked at, what are the different components that work together really well. And it's when you sort of include fathers groups and you include groups for adolescent girls in this case, you include, working with community leadership. And there were other components as well to that project, but when you bring them all together in a package, it isn't just one thing that you're doing multiple things. And that actually had a huge impact on the girls that were participating in those groups, because their fathers were far more likely to understand what the girls were coming home and saying, far more likely to support the girls in their aspirations. They were far more likely to say, in fact, the fathers who had daughters participating were almost uniformly saying, we are not marrying our daughters at an early age. They can pick for themselves, or in some cases they were saying no to bride price. And it was, the radical change that had happened for these men was having a direct impact on the future of these girls. And these girls were aged 10 to 19. So, I mean, their whole life was in front of them. And to me, that was a really powerful example of how working in multiple different ways on a project. So in this case, working with fathers has a direct impact on working with girls and working with their daughters, and how that sort of the whole ecosystem of that works towards gender equality.
Yeah, thanks, Meredith, for that great example. There's transformation happening at so many different levels. And unfortunately, we just have time for one more question, and I'm going to direct it to you, Saif. And this is from Maggie. Her question is on training for men. And she says that if we've identified, yeah, if we have you identified differences in the content and the method of training compared to previous developed for gender training materials, methods which are targeted at women? What are your key learnings which should be considered for designing gender training for women, men, and mixed groups? Saeed?
I think it's a great question because it's really important that how you design a training for men, women, or mixed group, for example, in the community. One of the key things which was really important for us to learn and unlearn was, and which we did, is to look at the literacy level of their target group, men or women, that way. In many instances, we have to work with community groups with a low to no literacy level. So that's important to use content which is less, for example, text-based and more pictorial-based. So that was something which is important. At the same time, especially when you're engaging men also, the experiential learning is very, very important. It's an adult learning environment in which you can, and especially on issues like gender and sort of social norms and behaviors, or centuries old tradition of sort of patriarchy, for example, and you're trying to talk about it and ask men, for example, to unlearn, or even women to unlearn those practices. Very, very difficult. And if you come like, oh, this is right and this is wrong, they were like, hold on. We also know what is right for our cultural context, and you don't give us something external and to force us change. Hence, there is an importance of using a methodology which encourages reflection. So what you do and why you do that, and what consequences it has on yourself, your other family members. So for example, roles and responsibility. So as opposed to telling them, okay, you start sharing cooking or cleaning, you talk about 24-hour cycle through experiential learning to people, help them unlearn. So it's really important to have pictorials and experiential learning and focus on reflection as opposed to teaching. So this is really important.
Well, yeah, thanks for that question, Maggie, and for your responses, Saif. Just passing it back to you, Saif, just for some closing remarks and some reflections.
Yeah, sure. I think it's been excellent quick 1 hour with loads of information. Thank you, Meredith and Alice, for sharing your wonderful experiences from your respective project, True Engagement and Religious and Faith Leaders. I think one thing has come up very clearly, that gender transformative change is everyone's responsibility. Also, as practitioners, we need to intentionally engage and provide a platform for men and faith leaders to address the root causes of inequality and foster an environment that encourages transformative change in both individuals and the broader community level. And there's a need for everyone to critically reflect on and challenges the broadly held norms and power dynamics that perpetuate gender inequalities. Also, at the same time, I think it's important to never discount the importance and possibility of engaging those you may perceive who have the most to lose, because in fact, they must have the most to gain in this context. And since gender transformative creates an opportunities for individuals and communities to actively challenge complex social and gender norms to address those inequalities, it is a lifelong journey, which requires sustained commitment and ongoing dialogue. And just lastly, I think safety needs to be created in the challenging norms and practices, and together finding alternatives. So I think this is really great to engagement and religious faith leaders in our gender transformative program. I think with that, I would just like to conclude this Zoom meeting and webinar. And Erica has already mentioned that she will be sharing all this presentation and the resources. There are loads of resources to all of you. And I'd like to thank once again Meredith, you, and to Alice for your sort of a wonderful presentation, and Erica for your this sort of the back end for many weeks, months to get ready for this presentation. And we'd like to also express our gratitude to CanWatch for organizing this particular event. Thank you, everybody.